So how do you find the best nursing home possible for your loved one or yourself? Alice Hett, a retired long-term care ombudsman for the state of Maryland, will focus on strategies and what to do to promote quality once your loved one is in a facility. During the session, there will be time for questions, and we will ask you to turn to the bottom of your Zoom page where there is a Q&A and invite you to type in your questions. And with that, I turn this over now to Alice.
Thank you, Brian, and good afternoon, everyone. I live in Maryland, where it is just a little afternoon, and I think for some of you, it is still good morning. So I'm delighted to be here. I've been doing work with nursing homes and around nursing home advocacy for 35 years, and I love talking about this topic because it's a topic that many of us avoid. And we just don't want to talk about nursing homes. We don't want to think about being in a nursing home for ourselves or for others. So I want to share some information that will make the process of choosing a nursing home easier, more concrete, the steps to take, and then give you some suggestions for promoting quality of care and life for when you or your loved one is in a nursing home. Just so you know, I'll be using the term resident to apply to the person that's going in a nursing home or that is living in a nursing home already. Some people in my field call the people who live in nursing homes elders. I've found for people in churches that's confusing with church elders. And also, not everyone in a nursing home is an older adult. So I will be referring to them as residents. I'm also going to use examples of people that I've gotten to know in the last 35 years and have been blessed to know and share their journey with them. They've all given me permission to use their information and to share it to help others in this experience, which can be really tough sometimes for families and for individuals. This is my friend Judith. She's one of 1.3 million people in the United States who are in nursing homes. There's 15,800 nursing homes in this country, and people of all ages are in them. In fact, when I was an ombudsman visiting nursing homes, we had one nursing home where a wing was set aside for babies. That's the nursing home I always wanted to visit, and I ended up there more than in other places. But these were very medically fragile young children. We have a lot of people in Maryland who are in nursing homes who are young adults. Maybe they've been injured in some kind of accident, or maybe involved with some kind of opioid issue. So there's a number of young people. And then, of course, most of the people in nursing homes are older adults. Judith is very special. She's been in a nursing home since she was 25 years old. She's now 64 years old. So I've learned a lot in my career from visiting facilities and getting to know people and running programs related to nursing homes. But Judith has been my primary teacher, and we've known each other for 30 years. She's a woman of great faith, and in fact operates a prayer group within the nursing home where she lives in Indiana. If any of you are in Indiana, let me know after the call, and I'll try to connect you with Judith. We're going to talk about four major things. Here they are. I'm going to give you a quick overview of the long-term care system, because you can't understand nursing homes without knowing what the system looks like. Then we're going to dig into how to find a nursing home. This is going to be the longest segment, because a lot of what you learn in that segment will apply to actually living in a nursing home. Then we're going to talk about people who live in nursing homes and their families, and how we can promote quality of care and quality of life. And at the very end, I have resources for you. Most all of the organizations that I mentioned today will be listed there, and we'll be posting other resources on the ALOA website. We're going to have a Q&A that Brian is going to help facilitate at the end of each of these different sections. So keep your questions in mind, or go ahead and write them into Zoom. And then as we get to that part of today, we'll try to answer your questions. So I want to talk for just a minute about the long-term care system. When I started my career 40 years ago, there were very few options for people. And basically, you were at home or you went in a nursing home. And when you went in a nursing home, you stayed in that nursing home basically until you died. That system has changed dramatically in my lifetime. There are so many options out there for older people now. And I've just listed them sort of in by acuity, but I want to make sure that you all understand that nursing homes are no longer what your parents experienced as nursing homes. We have a quite different network. There's senior housing that you can get with or without services, lots of home care. In fact, for the first time, it was part of the Health Care Act. Home Medicaid can be used to help keep people at home instead of in a nursing home. When it started about 7 years ago. There's assisted living. Assisted living are small group homes or can be very large group homes. They are typically not funded with Medicaid except in rare exceptions, but they are typically licensed by the state in which you live. And then nursing homes that we're going to talk about. Then there is subacute care, which is a higher level of care than a nursing home, and hospice care at the end of life. And my guess is that you all are familiar with these, but I just want to remind us that nursing homes are one segment of a very rapidly expanding long-term care system. And then I want to point out that retirement communities oftentimes have nursing homes co-located with them, and community care retirement communities, CCRCs, like the Lutheran Home here in Maryland, they have nursing homes and assisted living that are actually operated by the community care retirement community. And once you buy into living there, you have access to those services when you need them. I want to talk a little bit in more detail about nursing homes so that you know. Nursing homes are licensed with each state to provide nursing home care. In the old days when nursing homes started, there was very little regulation. People basically oftentimes opened their doors and called themselves nursing homes, and there was a lot of variety in this country. But in recent years, since 1987, there's been a law that regulates all nursing homes in the United States, and it's called the Nursing Home Reform Act. And that was implemented in 1987. That was started by a coalition of consumers, advocates, providers, nurses who worked in nursing homes, etc., worked together to get this Reform Act written. And it standardized nursing home care across the country. So your state licenses your nursing home, but the regulations are federal and are implemented by the state. Nursing homes serve very medically fragile people who need nursing care, and they help, and who also need help with activities of daily living. And the one thing to remember is that in a nursing home, there has to be an RN. Some people would call me when I was an ombudsman and they'd say, my mother went into a nursing home and there's no nurses on duty and I'm so frustrated. And it turns out they weren't in a nursing home at all. They were in an assisted living facility that was not required to have nursing home coverage. So people who are in a nursing home basically need nursing home care. And as I said before, they can be folks of all ages. Where in the old days, nursing homes were a place where people went and stayed for a long period of time. Nowadays, most nursing homes provide rehabilitation care as well as more prolonged stays of long-term care. In fact, I get a lot of calls from people in my church and my neighbors. They call me their consultant. And oftentimes those calls are, mom is in the hospital. They told me today she's going to be discharged tomorrow to rehab. Help me find a nursing home that mom can go to. So you may have a very short period of time to find a nursing home, or you may have a longer period of time. But it's a good thing you're on this call, because 1 in 4 of us who are older will need nursing home care. We'll go in the hospital, we'll have our hip replaced, other surgery, and then we'll have to go to a nursing home for rehabilitation, and then typically can go home or to an assisted living or someplace else. One term I want you to know is the word certified. Most nursing homes in the United States are licensed by the state to operate, but they also have to be certified. And certified means that they have met the requirements so that they can accept Medicare to pay for your care and Medicaid to pay for your care if you're eligible. Not every nursing home is certified, so you want to find out and make sure that the nursing home is certified, because most of us are going to need Medicare or at some point Medicaid for our nursing home care. I want to point out to you a term that not a lot of folks are familiar with. It's called SFF. That's a special focus facility. This is a term that the federal government has given to nursing homes who are quite troubled. And it used to be that the nursing homes that were SFF were not public knowledge. And so you didn't know if you were going in an SFF facility or not. But in recent years, consumers have advocated that we have a right to know if we're going into a troubled facility. So special, in this case, is not a good thing. When you go to the government website, and I'm going to talk more about it later, and they list an SFF facility, there will be a yellow triangle. And that yellow triangle is your heads up that that's a special focus facility. Typically, a state chooses the 3 most troubled nursing homes. And I don't mean a facility that has had trouble, in an isolated incident or some recent turnover, but these are facilities that for numerous years have had difficulty complying with the regulations and problems in care. So typically a state has 3 SFFs. Some states might only have 2 if they're a very small state. Some other terms I want you to be aware of. This is a very positive thing. A phrase that's often used in nursing home care and more in hospitals and assisted living is person-centered care. It's sometimes called person-directed care or individualized care. That means that the facility is focusing on the individual resident and what they need to have quality of life and quality of care. It's a very good thing, and there's actually a movement in this country to improve the quality of nursing homes. It's called the Pioneer Network, and I would encourage you to go to their website and learn about them. There's some examples that I think are very exciting called the greenhouses, where it doesn't look like it's a nursing home. It's maybe 7 ranch houses in a semicircle, but each house has nursing home care, and people within the house are like a family, and they meet the requirements of the federal law with RNs and other things. So the Pioneer Network is very exciting, and it gives a whole new picture of what nursing homes in fact can be like. Finally, I was an ombudsman for over 30 years, and I want to make sure you know what that is. An ombudsman is Swedish for advocate. Here in DC, we have ombudsmen for our newspapers. We have ombudsmen to call if our trash isn't being picked up. There's all ombudsmen for education, ombudsmen for children. In this sense, I'm talking about a nursing home and assisted living ombudsman. And we have 4 primary functions. We're the liaison between the resident and the community. We're educators, like I'm doing now, talking about long-term care. We can be a liaison with the resident and other groups like legal services or churches or libraries that the resident may want to access. And sometimes we're referred to as a citizen representative. We can work on behalf and with the 1.3 million people who live in nursing homes. Ombudsmen are mandated by federal and state law for those who live in nursing homes and assisted living. And if you have an aunt who is having trouble in a nursing home in Montana, you can go online and find out that ombudsman and call there and get information. They won't talk to you about details related to your aunt because they need to have permission, but they can help you learn more about what's available in that state. In 13 states, there are ombudsmen for people who receive home care. Ombudsmen have the legal authority to resolve complaints if that is the request of the resident and or their family, and to represent residents who are seeking remedies. So ombudsman being one was one of the joys of my life. I was a local ombudsman in North Carolina and the state ombudsman in Maryland, and then I ran the National Ombudsman Center. And what I want to point out is that ombudsmen do individual advocacy for residents and their families, but we also do systemic advocacy to try to improve nursing homes through public policy. I want to stop at this point and see if there's any questions now related to what I've talked about before I get into the details of finding a nursing home. I usually say when I do presentations that I won't start up again unless I get at least one question. So Brian, let's see if we have any questions.
We have no questions at this time, so you better get after them.
Okay, well, write down your questions and send them to Brian if you have any questions.
Again, just go to the bottom of the, bring your cursor to the bottom of the Zoom page, and there's a box called Q&A. And then type in your question.
So Brian, I think I'm just going to go on and then we'll pick up any questions in the next part, okay?
Fine.
Okay. When I talked about individuals and systemic issues and advocacy, I just want to point out that for many of us, finding a nursing home and getting our loved ones in a nursing home is a very serious and complex issue that we need to deal with and address, and we want to do it in the very best possible way. But it is also a very much a societal issue for our country. Think of it, 1.3 million of us are in nursing homes. The average cost is $83,000 a year. A lot depends where you live. Here, where I live in Maryland, it's significantly more expensive in a lot of facilities than that. And about 70% of everyone in a nursing home is on Medicaid to help pay for their expenses. And I'll be talking more about funding sources in a minute. But bottom line is long-term care is expensive. And one of the reasons there's new initiatives in healthcare reform is to help people meet their needs in a more cost-effective setting, and a setting that they prefer, which might be their home. So when you're looking at finding a nursing home, and I think hopefully before it's urgent, there's 5 things that you really need to consider. And I hope you're not trying to write these down because you'll be able to go to the website and access it pretty easily. But you first want to consider the type of facility that's needed. You're going to want to look at location. You're going to want to make sure that the preferences of the person needing care, that you know them and that you try to help them find a facility that can meet their preferences. You want to make sure that you have a pay source that can pay for this. And then you want to look at, does that facility provide quality of care and quality of life. I have to be honest, placement in a nursing home may be very difficult. At a conference last week, one of the participants said, "This may be the last thing I can really do for my mom is to find a good nursing home, and I have a lot of stress because of that. I don't want to mess this up." And I've met many people who find this to be very, very difficult. Sometimes when people are very medically fragile, placing them in a nursing home can be one of the best things you can do for your family, because then instead of having to provide the care, which you might not be able to do any longer, you can spend that time enjoying your loved one, providing love, having meaningful interactions. But it's a very difficult decision to move someone permanently or for a long term into a nursing home. For short-term placement, it's a different situation, but the problem with that dynamic is that you have to make a decision oftentimes very quickly. The goal needs to be to minimize transfer trauma. And to be really honest, moving someone to a nursing home or an assisted living often involves some kind of trauma. It means acknowledging that they have lost the ability to stay at home and acknowledging losses to a person's physical abilities, sometimes to their mental abilities. So strategies to minimize transfer trauma are to involve the person going into the nursing home absolutely as much as possible. And if they are competent and able, to make sure that they are empowered to help make these decisions themselves. The more a person can visit a facility, the more they can identify what it is they want, the more they can choose the items they want to take, the less transfer trauma that person will have. This is my mom. Whoops. She, in this picture, was 80 years old. I think she looks just absolutely beautiful, but she was very medically complex. She had Alzheimer's disease, heart disease, Meniere's disease, so most of the time, or many times, she felt like she was just spinning a good bit of the time. She had issues with her breathing and some minimal arthritis. I'm sharing this because my mom never needed to go into a nursing home. She got her care in a fairly large assisted living, in and out of the hospital several times. Then that didn't work for her anymore. They couldn't meet her needs because she couldn't articulate her needs very well. Went into a small group home that had about 8 women and a big kitchen and lots of staff, and stayed there with hospice services and died a very beautiful death where they lovingly fed her ice cream, her favorite food, before she passed, and sang her favorite hymns to her. So I'm using her as an example to point out that nursing homes are an important option in our society, but nowadays we have other options as well, and you may want to explore those for your loved one. This is my mother-in-law. Her experience was a little different. She was in a quite large assisted living for 13 years, but an assisted living that really promoted independence. And if you can see her shirt, she was head of the resident council, and she would always wear this shirt. It says "surrounded by nuts." And that was just her personality. She was very fun-loving. She had never been a leader before, and she became president of the resident council. She had to go back and forth to nursing homes and to the hospital and nursing homes 4 different times for rehabilitation. And all of those required a quick decision about where mom should go to get the best rehab possible. And then she went home, and actually at the end of her life, she was in a hospital, chose to go home and died, and then died almost immediately after she got back to her assisted living. She called her assisted living her home, Some people who live in a nursing home call their nursing home their home if they're there for a long period of time. And that's what we want as a society. We want these places to be comfortable and where people can have a meaningful life regardless of their situation. This is my friend Floyd. He's very disabled in many ways. He does not have ability to walk. He's somewhat limited with his hands. Was in a nursing home, did rehab, went back to a nursing home. People told him he'd have to stay in a nursing home his whole life. And then over recent years, these programs have developed to help people stay at home. Floyd stayed in his own home, not only for himself, he was actually caregiver for his mother who had Alzheimer's disease, and other people came in to assist with that. Floyd in recent years has started a organization called the Sunshine Folk, who are all people who lived in nursing homes and came out of nursing homes, and now they visit nursing home residents and help them know their rights to leave the facility and to live in their own home. I'm not going to talk a lot about that, but I just want to make sure that you know that home and community-based care services are available in many communities. So you want to think with your loved one, what kind of care do they need? Is it rehabilitation, ongoing care, respite care where the family's just worn out or maybe wants to go on a vacation, so mom has to go to the nursing home for a week or two to give the family some respite? Particularly want to consider, does your loved one need memory care? Do they need end-of-life care? Hospice can take place in your own home. It can also take place at hospice centers, and oftentimes hospice supplements nursing home care and takes place actually in the nursing home, so the person has access to nursing home services. And then you want to know if your loved one needs a facility that has a particular expertise in terms of a particular disease. So if a person had kidney failure, the ideal would be to have dialysis right there at the nursing home, as opposed to having to get into a van, go and get dialysis someplace else. Of all the things I ask people to think about when they're looking for a nursing home, location is near the top of the list. Most of us, when we think of ourselves going into a nursing home, we want our family and friends to be able to visit us. That will result, for me, in a higher quality of life than if my nursing home was 20, 40, or even 2 hours away. When I started my career, oftentimes people in North Carolina had to go up to 2 hours away to find a nursing home bed, and the quality of their life was extremely limited. Another thing to consider is, will your loved one have access to spiritual care, their faith leaders, their deaconesses, their church members who can visit them? And then, like I said before, location in terms of access to needed services. Another thing to consider, especially if you live in an urban area, is the time it takes to get to the nursing home. Here where I live in Maryland, there are several really good facilities more towards the Annapolis area, and people like to go there rather than driving within our own urban area, because it's much speedier to drive to Annapolis than to drive to some of the facilities in my county. I've talked about this before, and I can't overestimate it, but you need to have a conversation with your loved one about what will be important to them for the quality of their life, what nursing home they may prefer. My mom had very strong opinions that she articulated to me before her Alzheimer's got very advanced about what nursing home in Idaho she wanted to go to and which ones that she didn't want to go to because of her personal experiences. I have an aunt who wanted to go and was able to go to a nursing home near both of her daughters. But really need to make sure that you engage the person who's going to a nursing home. This may not be quite as important if the person is going in for rehabilitation, because then for most of us, the goal is we want to get out and we want to have the best rehab that we can. So other factors for quality of, our definition of quality of life might be different in that circumstance. But I wanted to share with you the research that's been done on what residents find most important. And when the research was done, it was, I think, assumed that cleanliness would be at the top of the list, activities would be near the top of the list, certainly affordability. But what was found that residents wanted more than anything else to be treated with dignity and respect, and to be treated as a unique individual. They wanted confidence that they were going to be cared for with their individual needs being met, but also that they would be able to develop relationships. And I'm talking now particularly about people who are going into facilities for an extended period of time, although it's important in rehabilitation as well. What we've learned in the research is that quality of life is as important as quality of care. So we can't just look at what kind of care does a facility provide, but what kind of quality of life do they have? And relationships with residents are very much impacted by the number and the type of staff and the training that staff have. So if your nursing home is short-staffed and they have to bring in temporary staff from the outside to meet the resident needs on a regular basis, the capacity to develop meaningful relationships is going to be pretty limited. But if you have a facility who treats their staff well, that has very good training for the staff, that encourages the staff to be engaged with residents, the quality of life is going to be better. Whoa, I lost it. I want to talk about money. I always have to say money, honey, but I guess some people consider that to be disrespectful. But the cost of care is important when you're seeking a facility, because you may have options that you haven't considered utilizing, and you may need to understand what your options are as you seek care. So the first thing you need to do is to look and see, do you have long-term care insurance? Sometimes we forget. I have a friend that bought a policy from Thrivent 35 years ago, so now has a diagnosis of Parkinson's, dug up the policy, had forgotten really what it covered, and the coverage has been extraordinarily good, including helping him to revamp his home so that he can stay in his home and utilize that policy in the home, and then when he needs nursing home care, utilize it for that. So you need to check the policy. Here's a warning. Some policies that I've come into contact recently do not go into effect till 90 days after the person is in a nursing home, or 90 days after they're at home. So the family would have to provide that revenue for those first 90 days, or some other pay source would have to provide it. So check your policy now so that you'll know what is covered. Medicare is important to know about, and I just want you to remember that Medicare refers to medical need. People get Medicare and Medicaid mixed up. Medicare refers to medical need. So if you've been in the hospital and you need rehab to rehabilitate, and usually you have to be in the hospital at least 3 days, then Medicare may cover your care. And most rehabilitation, Medicare, for seniors, Medicare will cover those first days of rehabilitation. I think it's one of the wonderful things in our society that we can get rehabilitation in this way. Medicaid relates to income level. And I told you before, 70% of people who are long-term in nursing homes are on Medicaid. So what would happen is I would go in a nursing home. I've been in the hospital, then I rehab. I'm just not strong enough to come home. I don't have family who can take care of me. So I'm going to stay in that nursing home because I'm medically fragile. I will use my own money first, my long-term care insurance, my personal funding, and then when I don't have those resources anymore to cover the whole amount of care, Medicaid will kick in. So if you're in a nursing home and your resources are limited, you cannot be discharged because you can't pay private pay anymore. You will be able to go on Medicaid. You might have insurance that's going to cover some of your long-term care. I worked with a woman this week, and her insurance is going to cover her rehabilitation because she's not old enough to be on Medicare, and her insurance is going to pay for that. You might be private pay. There might be options that I haven't offered. Now we're going to get down into some nitty-gritty, and I hope that you'll bear with me. But I want to make sure that you consider in your nursing home choice quality of care and quality of life. And every nursing home is inspected. It's usually between 9 and 15 months. It's supposed to be unannounced. If there's problems, the inspectors go back. Those reports are called survey reports, and those are public record. You can get them online. Every nursing home is required to have it there near the front desk so that you can look at it. But the quality of care is extremely important. And you can find that out from the survey reports. You can find out from the reputation of the facility. There is a 5-star ranking system by the Centers for Medicare and Medicaid. You can look at quality by asking about the staffing and learning more about the capacity to do rehabilitation. The quality of care and quality of life is not particularly represented by having a fancy or beautiful facility. I know sometimes as family members, we're attracted to these facilities that are new and, very, very nice inside. But there are a lot of things that are represent quality besides the actual building itself. So some of the best nursing homes I've seen are older facilities that have a lot of staff and lovingly care for their residents. You may want to look at if the facility is profit or nonprofit. The research shows that most not-for-profits have better quality of care or have more staff than for-profit facilities, and oftentimes more staff translates into better care. I will say that's not always the case. So just because you think, oh, I'm Methodist, I'm going to go in the Methodist home, or oh, I'm Lutheran, I'm going to go in the Lutheran home, it always warrants checking out all of these facilities. So I'm going to look with you for a minute at a resource that you might not know about. It's called Nursing Home Compare. Nursing Home Compare is by the federal government that includes a ranking system based on different dimensions of the kind of care that a nursing home provides. And I've used the acronym CMS here. That stands for the Centers for Medicare and Medicaid. So this is based on the inspection of the facilities. It's based on their staffing, and it's based on something called quality of measures. When you go to Nursing Home Compare, you can look up the fire inspections for the facilities. You can look up their inspection reports for the past 3 years. You can find the addresses. It's an amazing resource. It's not perfect, and you have to do your homework besides looking at this, but it's a really good place to start. And I would encourage all of us that have older loved ones or that are older ourselves or church members who might need nursing home care, just take a look at Nursing Home Compare and see what's near you. And this screen is what it's going to initially look like. And you put in a zip code or you put in the name of your city, and then all of the nursing homes that are available in that area will come up. And if I'm showing you the next screen, you'll see in my area, 20784, there are 94 results. So there are 94 nursing homes within 25 miles. And then you can narrow that down. You can say, tell me all the nursing homes in 5 miles or 10 miles. You can say, tell me only the 5-star nursing homes, only the ones that are deemed to be the very best. But this particular facility I put in here on purpose. It's Hillhaven Nursing Home. It's run by a family, which is kind of unusual. A lot of nursing home care now is corporate. I believe the owner of the nursing home and the administrator are all are nurses. But they've had a very high ranking and very good inspection reports for as many years as I've lived here. And I've been doing this work in Maryland almost 20 years. So you'll see on here, there's the overall rating of the scoring, which is 5 stars is the whole highest, much above average. The next part is the health inspection. The next part is staffing measure, and then quality measures. Quality measures are things like, have the staff had their flu shots? Do the residents have their flu shots? How many of the staff, or how many of the residents have pressure sores? There's all kinds of quality measures. If I'm in a hurry, like someone needs to find a facility the next day, tell the hospital what they want, I focus on the overall rating and on the health inspections and a little bit on the staffing. The staffing has not always been accurate, but recently the government's done a better job of having more accurate staffing information. But the health inspections, you can actually click on there and find the actual report and see what it's all about. I'm showing you this slide because it has the yellow triangle. I should ask you all if you could talk back to me if you remember what that means, but this is a special focus facility. You don't want to go to this facility. I would not recommend it. And you can see they don't even have data on the main areas of healthcare. Hopefully, and that would be my prayer, that with the intervention of the government and more inspections and other assistance, that the next time we pull this up, it will no longer be a special focus facility. I pulled this up for you to see how you can compare nursing homes on Nursing Home Compare. You can choose 3 nursing homes and pull up their report and compare them side by side. So I basically chose the 3 primary Lutheran facilities. You can see there is a range of stars, 2 stars, 4 stars, 5 stars. You can see there's a range on staffing and a range on the quality measures. And then you can drill down even further and look at more of the details. So if I were you, I would pull up the nursing homes, I would identify a few in my neighborhood, and then I would look at other ways to find out information about them. And just one thing to remember is that you may have, or your loved one may have, some preferences for a certain nursing home that would make that a place they would want to live, even though the facility only had a 3-star ranking. So you have to weigh in all of the different factors. And I'm sure that a nursing home that has 1 star or 2 stars, if you ask them how they had improved, they would hopefully be able to tell you how they've improved their facility so that they are no longer on the low end. Another thing I want you to look at, if you can look at this chart, it says number of health citations. That is the number of deficiencies, the number of problems that were identified in the inspection. So this inspection was done in June of 2019. That's pretty recent. And there were 10 problems identified. They could be large, they could be small. Probably pretty small, I would think, because they got a 4-star ranking on their inspection. The average in Maryland is 15 citations. The average in the United States is 8.2. I think in Maryland, we're a little more vigorous on our inspections of nursing homes than maybe some other states. Some people say it's because we have more problematic facilities than other states, but I don't want to get into that now. So this is an important decision, and you need to talk with people who can help you. Your hospital discharge planner certainly has a lot of ideas. My experience is that some of them are very, very skilled and that others are not. You want to talk to your Ombudsman Association, your faith leaders, so on and so forth. After you find the facilities, you want to go and visit them. You want to use all of your senses in visiting, and there are some good checklists that you can look at for questions to ask and things to do when you visit the facility. Then you have to talk about how the person is going to get to the facility and how to make those first few days a good adjustment to the facility. I hope things work out for you as well as things worked out for my mom. At the end of her journey in finding a place to live, she said, "I feel like I'm in a safe nest. I can figure it out." And what she was saying is with her dementia, she couldn't understand her house anymore. She didn't have the ability to cope. But in the facility, she had a consistent schedule. Her family and friends could visit, and she had great interaction with folks. Brian, let's stop there for a minute and then take some questions. Brian, I can't hear you. I think
Yes, I muted myself.
Okay.
This is from Gail Lutz. How much say does an individual have in where they are to be served when Medicare, Medicaid chooses to move the individual after the 20-day required period? If the individual needs long-term care, how many moves like that are permissible? I am asking this because a friend is in this situation after heart surgery in Florida.
That's a really good question, and I want to address it now. I've addressed it later in my remarks, but I'm running out of time. So I'm going to be blunt. Discharge from nursing homes in this country is a serious problem. And as an ombudsman, it's our #1 complaint that we get about people being discharged. So the factors to look at is, #1, the facility where your loved one or your friend is at, does it even have any beds where they can stay long-term? Oftentimes, there are some facilities that focus so much on rehab, they only have a few beds. The other big thing that needs to be considered is the pay source. So if your friend is primarily on Medicaid, it will be more difficult to find an alternative than if they're not on Medicaid. But the bottom line is when it's time for discharge, the person's to be given notice. They are to have choice about where they go. This is not to be a decision by the social worker or by Medicare or Medicaid. The steps that I went through, they should be able to go through in having choice about where they go. So this is a situation where I would definitely contact the ombudsman. Your friend should get a discharge notice. That discharge notice should have the name of the ombudsman on it for assistance. They may need to utilize legal services as well. And in the meantime, I would be helping my friend to help identify what nursing homes might be available based on what I said and how to go about finding them.
So an ombudsman would be a good resource.
Yes, it's our #1 complaint that we have to address in the country. If the nursing home where the person is at has beds and the person has a pay source to stay there. The ideal, if that person wants to stay there, is that they could stay in their own place that they've become used to. Do you want to give me another question?
Yes. Walter Teachin, where does one find survey for quality of life?
Well, there's not one. And in part of that's because it's so hard to measure quality of life. But when I'm looking for quality of life, I'm looking for what opportunities are there for the resident to make choices. Is the facility person-centered? Is it part of the Pioneer Network and the Greenhouse Movement and other places that really focus on that? The other key thing I look at is staffing. Are there adequate staff? Has there been turnover? Frankly, if I was looking for a nursing home and the director and the of nursing and the administrator had both turned over in recent months, I would not put my loved one there. But quality of life is very much in the eyes and the experience of the person who's moving in to the facility. So what might be quality of life for me, which is access to my family and friends, having a choice of food, which all facilities should be providing, having a choice of activities, that's the ideal. So we have never figured out in research or as ombudsman how to fairly develop a factor related to quality of life. I wish we had. Let's take one more question because
Can you speak more about Medicare coverage and criteria?
No. It's a very complicated topic. Some younger people who are disabled are on Medicare. So that is something, if you're interested in a particular nursing home and apply to go there, they should be able to assist with that. If you're in the hospital, definitely the discharge planner should be able to help in doing that. But remember, Medicare only pays for the rehabilitation part of nursing home care. It does not pay for long-term stays, which is a misconception in our society. Is there another one?
No, that is it.
Okay. I'm going to talk just a little bit more. Carol, I think we maybe need to set up another call about how to get quality care once you're in the facility. But I want you to know that all of the information and suggestions that I have are on my slides that you'll be able to access that we weren't able to get at today. But I want to highlight just a couple things before we end this call. First of all, the nursing home reform law guarantees that residents have certain rights. You don't lose your constitutional right to vote or to get unopened mail or to handle your money just because you go into a nursing home. Care is to be individualized. I'm just going to move on here a little bit. I want to just share a few things you can do to get better quality. You can paint a picture of your loved one in the assessment process, in the interactions with staff. You want the staff to know that your loved one is a unique gift of God, a unique child of God with a rich history. This is how I describe my mom. And you can paint that picture with pictures in the room and individualize the room so that the room helps the staff to understand about your loved one. I encourage you to visit at different times in the week and different times during the day to participate in activities with your loved one. This was quality of life for my mother-in-law. We would rent a fancy car and take her out for a drive. So quality of life certainly varies. For Judith, quality of life is being able to worship. I'm going to go on here a minute. The most important thing I want you to know is that care planning is required under federal law. You have the right as a resident to participate in your own planning of your care. It has to be done at least quarterly, and it has to involve the resident, the family members, if the resident wants those people there. If there's a problem in a nursing home, I would definitely say, I want to request a care plan meeting to discuss that. It's an option that residents have and family members have. So just remember, care planning, it's not something optional that facilities do. They have to do it in a short period of time when your loved one is admitted, and then in a longer period of time when you're loved every 3 months or more frequently than that as it's needed.
Alice, before you go on, we did have one on the chat box, and it's not really a question, but just an addition, and it's from Paul Haverstock in Illinois. And he says, for what it's worth, from my recent move from a 3-bedroom, 3-bath home to Senior Solutions, he's suggesting stored photos to write identifications or discard. Clarify minimals to be taken along, family choices of other items, and be sure choices yet to be enacted are in writing.
That's very good concrete advice, because those objects carry meaning for the people who move, and they also tell an important story. A sidebar that I want to mention, Good Samaritan facilities are very common in the Midwest. My grandpa was in one. These are often considered Lutheran kinds of facilities. They offer a lot of options for folks. As always, you'd want to need to check out their nursing home care. But besides facilities having the word Lutheran in them, for those of you that are Lutheran, I would certainly look at the Good Sam facilities. These resources have the list for fact sheets done by the National Consumer Voice for Quality Long-Term Care. That's the consumer advocacy group that I ran for a number of years. They have all kinds of solid information, including a lot of information on discharge. So the woman who asked the question about discharge, the resident, your friend, has a lot of legal rights and can ask for an appeal and get time to initiate decisions that she wants to make. So go to those fact sheets. I put in Find Your Ombudsman. That's a map where you can find an ombudsman any place in the country. I put in the link to Nursing Home Compare and the Pioneer Network and Elder Care Locator. So I hope those will be useful to you. In terms of wrapping up, I just have to say a couple things. I'm passionate about yourself. Please, please don't wait till you need care before you start thinking about nursing homes. You should be knowing what's in your area, or be able to tell your family members, I prefer to move to Iowa, whatever. I personally prefer to move to North Carolina. I'm in Maryland now for a whole lot of reasons, including that the care is much more affordable. But don't wait to have that conversation. Thanksgiving's coming up. Have these conversations about care, not just nursing home, but assisted living and across the board. And finally, I would urge you, please visit your family and friends and church members who are in nursing homes. 40% of the people in nursing homes have no regular visitors, family or friends, including my friend Judith. So please consider visiting these folks. And if your congregation is looking for a meaningful ministry, consider visiting nursing home residents, not just at Christmas, but throughout the year in meaningful activities. Many times when I visited a nursing home, and this has happened hundreds of times, the residents sitting there with a church bulletin or a newsletter, and I'll ask them about it, and they'll say, this is my church. But when I say, when did you last see somebody from your church? They might say a month or a year or 2 years. So we have a lot of opportunities for ministry, and I just encourage you to utilize those. My email address is on the front of my presentation, so you can go online and ask me questions. I'm sorry I couldn't get to everything, but I think it's time to wrap that up.